So it's time for the Newstrack showdown tonight. Has the Indian government done a good job of fighting COVID? For a long time, the government claimed that India was an international case study. Our case fatality rate was low. The spread of the infection was under control and India was being looked at internationally. Now, of course, cases are surging, 11.5 lakh plus already. We could overtake Brazil, going by the current rate of cases increasing in India. Joining us on the Newstrack, Dr. Sambit Patra, firebrand spokesperson of the Bharatiya Janata Party, squaring off against him, Supriya Shrinate, spokesperson of the Congress. I want to start this debate with Dr. Patra because it was during the initial weeks of the coronavirus a matter of great pride for the government that internationally the number of cases, the number of deaths, the spread of the infection was remarkably low, that advanced countries were struggling, but a country like India was on top of the virus. Now, with cases crossing 11.5 lakh already, and the spread, daily spread also being at a very high level, questions will be asked whether a lot of the government's claims have turned out to be jumlas, and in reality, India isn't doing as good a job as the government would like citizens to believe. We'll start the debate with Dr. Patra.
Thank you, Rahul, and I'm happy that I'm in your debate. At least we won't have the usual tutu meme abuses that generally nowadays is happening in the debate. I have brought the report card of today, and I would like to present the report card as far as corona is concerned. Number one, how did India perform? Laboratories. In fact, when we went into lockdown, there were 113 government laboratories and only 47 private laboratories as on March 30th. Today it is 1,115 laboratories in total. Testing per day, only 1,500 previously, and today 2.80 lakh per day. Recovery rate, one of the most important things, 7.10% as on 25th of March, and today it is a whooping 70% almost as far as the recovery rate is concerned. Death rate, and this is extremely important, I would like to emphasize because this is a global comparison. As of 15th of April 2020, the death rate before the lockdown was 3.3. Now, today it is 2.83. The global average death rate is 6.45. This is where India stands apart as far as performance globally is concerned. Death per million population, again I would like to draw your attention, while globally the death per million population is 68.29, capital letters 68.29. In India it is 14.27. Of course, any death is regrettable. COVID hospitals, from 0 COVID hospitals to 111 COVID health centers, dedicated COVID care centers, 9,910 dedicated hospitals, total COVID beds, 20 lakh plus. PPE kit, I would like to emphasize, Rahul, and you have been saying about it, from importing PPE kits, India did not have any industry on PPE kits, to manufacturing more than 4.5 lakh PPE kits per day, N95 masks, from importing N95 masks to today producing 3.5 lakh N95 masks per day, ventilators from importing to being self-sufficient, patient doubling rate, important again, from 3 days initially to 15 to 20 days today, and importantly, 2 or 3 more lines, active number of cases in ICU as on today while I debate with Rahul Kanwal is less than 2.5%, a good news, and active number of cases on ventilator is less than 1%. Of course, India is doing well, good, and I would say right interventions were made by the Prime Minister at right time. There was a projection which in fact was contested by many but was found to be true later, that had we not had the lockdown at the right time, then probably the number of cases would have been in millions, somewhere around 30 lakh cases, in fact 1.5 months back. I would conclude by saying that, well, yes, a healthy politics should take place. Question and answer is what democracy is all about. But sarcasm and taunting is something is not required. And showing the mirror to Rahul Gandhi, Rahul ji, please look at what's happening in Rajasthan. In Fairmount Hotel, the way your MLAs are fighting corona, they say, "Aaj pizza banana seekh liya hai. We have learned pasta. Now we will learn the songs of Mughal-e-Azam, and at night we will have Antakshari." Is this the way to win over corona, or the report card that I presented was fair?
Okay, Sambit Patra has just got this debate off to a cracking start. Supriya Shrinate, Dr. Patra citing recovery rate, death rate, death per million, COVID healthcare centers, hospital numbers, bed numbers, ventilator numbers, PPE kits, cases in ICU, to make the case that it's not as if the government's been sleeping on the job. The government's gone all out in an emergency wartime-like effort. And yes, the cases are increasing, but it's not because the government didn't do what it could, but in spite of that. And they're accusing the Congress of being busy playing Antakshari and starting Twitter wars and having their priorities all right and having nothing constructive to offer. Supriya Srinath.
So 3 minutes 32 seconds is how Dr. Patra spoke, and I hope I will also have a free run at least 3 minutes on this. I'll be briefer, I promise. The thing with statistics is that you can interpret it any ways, and I think there are certain numbers that should be put on the table and some perspective that should be added to that. 11.6 lakh cases. We are number 3 in the world as far as the corona case table is concerned. Our death rate, yes, is at 2.83%, but we are at number 8. Now, that is where perspective comes in. Number alone doesn't mean anything here. We are the youngest nation in the world. 5%, only 5% of our population is above 65 years. Half our population is under 25 years, and then to have death toll of over 28,000, many experts believe, is a high figure. Russia has half our death toll with almost similar number of cases. As far as testing is concerned, and who would like more deaths? Nobody would. We would want corona to be under control. We would want the situation to be under control. Testing rate. We are number 3 as far as infections are concerned, number 8 on death. Where are we on testing? We are at number 87 as far as testing is concerned. Yes, we've got so many private labs and so many government labs, but is aggressive testing being done? Because that's the only way you can control corona. 40,000 new cases every single day. This despite some very stringent lockdowns. I am going to now come to a point-by-point analysis of what Dr. Patra said. I agree with the fact that, you know, everybody would want these numbers to come down. But as far as COVID hospitals are concerned, your channel, and I would compliment the India Today team, which has been at the forefront, and so has Aaj Tak, to expose the kind of hospital facilities they exist across the country. There are facilities in UP where there is a free waterfall happening because there is rain. Gorakhpur, which is next to my constituency in Maharajganj, has a room full of water where the COVID patients are kept. So I can go on and on, but I don't want to. But as far as, you know, saying global average and all of that is concerned, let us please remember, we've had 4 most stringent lockdowns in the world, which no other country had. And which is why one has to question the priority of the government. What is the priority of the government? And I think Mr. Gandhi is absolutely justified in asking questions. He's not being sarcastic. He is only giving you a blueprint of what has been done. I will just give 4 dates and then I'm going to end. 31st January, the first corona case was detected in India. 30th January, WHO had already declared corona a World Health Emergency. Rahul Gandhi warned on the 11th of February, this is a big tsunami coming, no attention was paid. On the 11th of March, WHO declared it as a global pandemic. Why did we not go in for control measures then? Why did we wait up until the 24th of March? Because they had to topple a government. They had to do the Namaste Trump event in February. And remember, when Mr. Trump came visiting to India, there were 75 live cases in the US. And some states in the US had also gone into a lockdown. We still went ahead with the event. That is why I say priority of the government.
Dr. Patra, now here's a concern. The government wants to project very naturally that it's doing the best and the most that it can. And as a result of this, on certain matters, we seem to be in denial. Take, for example, community spread. The government hasn't even accepted that in certain pockets, in certain hotspots, there is a community spread happening. Because if 11.5 lakh plus cases and counting, we still are not publicly willing to accept that there is community spread, which internationally experts are just looking at India in bewilderment and saying, how are they not accepting what is so obvious? That's point number 1. Point number 2, you cited recovery rate. And that 70% are recovering, which is fantastic. As time goes on, soon 97% will recover because the number of people dying are between 2 and 3%. What we are not looking at is the gap between the number of people getting infected every day and the number of people who are recovering every day. Now, you are a qualified doctor yourself and you realize that if there is a 60% gap between daily active cases and daily recoveries, it means that the spread of the infection is still growing. Whereas because we want to show to the opposition and to everyone else that we've got the situation under control, we keep citing what you well know is a statistical placebo. The recovery rate, the overall recovery rate is something which makes you feel good, but actually, and so you know this much better than I do, from a medical perspective, epidemiological perspective, it means nothing. Dr. Patra.
See, two things. First and foremost, as was said by my opponent, that in fact interpretations of statistics are left to open. You can interpret it either ways. I believe statistics are the best way of projecting the truth, because they are data which can be interpreted, and they can be interpreted to project the truth, number one. Number two, you were right that the recovery rate and the ones who are infected daily, there might be a gap. But remember, mild infection and death rate, these are two extremely important points that I would like to bring in. Are we able to manage the infections? Are we resourceful enough to quarantine the people? Are we able to isolate them? Are we able to take them to ventilator if they need one? Well, yes, India is in a position today, despite the fact that America, Italy, Spain, and some of the most developed countries, being resourceful countries with their health management system being best in the world, are not able to do so. But look at the way, and I'll give you an example of Delhi. The day Mr. Amit Shah stepped over into Delhi, Delhi's case was in a decline. The way it was managed, I want to in fact present a bipartisan phase over here. I don't want to go into a kind of mudslinging. Both the state government and the central government working together, look how Delhi is improving today. And when the Congress party points a fingers towards us, my question would definitely be about Maharashtra. A free hand has been given to Maharashtra. You have an Aghadi government there. Every resource is at your disposal. But still, some of the most dismal picture that we see today is in a state where the government is in power. I mean, the Congress government is in power. We see what is happening in Rajasthan. Despite the fact that Rajasthan was praised by the Prime Minister, the kind of attitude, the kind of callousness that the MLAs are projecting today is something which is absolutely, I would say, demeaning to the feelings of people. I mean, just imagine a corona patient watching Antakshari on a television channel. And let me tell you, despite the fact that we are a resource poor country, we were a resource poor country, we did not have ventilators, N95, PPE kits. But I salute, well, yes, there were certain sting operations by your channel as well as by other channels on certain hospitals. There are isolated cases of negligence, I agree to that, but I give a big salutation to all the corona warriors, because I have been a patient. I know what they have done. I know how they come forward to treat you. So to say that lighting a mombatti, to light a candle for the corona warrior was a disaster, I believe Mr. Rahul Gandhi should realize that corona warriors also are human beings. They really need some amount of encouragement. A pat on their back is no wastage of calendar.
Okay. Supriya Srinath, to find fault is easy. I had to go to a hospital recently. Now, just one second, hear me. And I made some inquiries about the status of the availability of beds, the availability of ICUs. The reality is, in this moment, in big cities, and let's take the national capital as an example, more than 50% of the COVID capacity that's been created is empty. ICU beds are lying empty, hospital beds, both government and private sector, are lying empty. So you can find fault, but given the nature of this virus, given the size of our population, a certain spread is inevitable. At this moment, there are hospital facilities available for those who need them. So it's not as if the infrastructure is completely crumbling and the government hasn't done anything. They have increased capacities, and to some extent those capacities are still available for those who might need it. Supriya.
You know, Rahul, nobody will contest the fact that this is an unprecedented situation. Nobody had an idea about the virus. This came and hit the world from nowhere. And one grants the government that they would have had to do all of this. But it has been 5 months. And I'm going to, you know, in a state like Delhi, the government hospitals perhaps have some empty beds. But till not so long back, the situation was very pathetic even for private hospitals. I'm talking about a state like UP, where I was born and raised in Lucknow. There are no beds available today. In a city like Gorakhpur, there are no beds available today. So I'm just talking about capacity building where we had time and we should have built capacity. However, having said that, as far as the doctors and encouragement is concerned, I completely agree with Dr. Patra, and I'm sorry he had to go through this ordeal of corona. I don't wish this upon my worst enemy, and I have also been in and out of a hospital during this pandemic, and I'm sorry you had to visit one. But I will say this, that as far as doctors are concerned, you know, we saw doctors asking for PPE kits. We saw doctors being shunted out because they procured PPE kits on their own. We saw a doctor being sacked because he put out a public message for PPE kits. That's not how we can treat our doctors. Nobody says don't celebrate our healthcare workers. Of course we have to. But I will go back to a point about community spread. Government says there is no community spread. But the Indian Medical Association on record has said there is a community spread. And I think, Rahul, the point that needs to be debated is, it took us 109 days to go from 1 lakh to 2 lakh. It has taken us all of 3 days to perhaps get from 11 to 12 lakhs, which we will by the end of the day today. And it took us just 3 days to get to from 10 to 11. So we have to see the rapid increase. And you know, we can't, and I don't think we can be fighting this battle on the basis of my governed state or your governed state, because in the top 10 there is Gujarat, Karnataka, there is Uttar Pradesh, but that's not how we can fight this battle. We are fighting this as a country. We cannot fight this as if your governed state and my governed state. There are people who are suffering and they're all Indians.
I have time only for one final question, Dr. Patra. And I want to build on this. While yes, you can say that extra capacities have been created, a lot of those additional new capacities are in urban pockets. This virus is now dangerously shifting to rural India, and the reality there is, even at the best of times with no pandemic, healthcare infrastructure is very poor. We simply haven't built enough capacities in rural India to be able to contain the spread of this virus or to treat those who get infected. And once the virus starts rampaging through rural India, things could get far worse than they've got so far. And for that part of the fight, Dr. Patra, are you certain that we are well equipped? Because the reality, as is coming out from so many pictures, you know, there's a very alarming image that appears in rural India in all those hospitals.
Yeah, I'm certain that the country is prepared, and whichever state it may be a BJP ruled state or it may not be a BJP ruled state, but all the governments are trying their best to see to it that if rural India suffers the way, in fact the urban India because of its population density is suffering, then of course we have everything ready. Because my friend, my opponent from Congress party mentioned about Uttar Pradesh and as to how, as she said, probably situations were not right in Uttar Pradesh, I would just remind you, Rahul, one of our anchors in India today, a good friend of all of us, and Supriya would be knowing her. Pooja Sairi herself suffered. I mean, may she always be healthy. We both were in fact suffering at almost the same time, so I was following as to who all were suffering. Pooja was in UP, and Pooja wrote a beautiful op-ed as to how UP government contained the whole thing, as to how she was taken to a UP government facility, and how she was treated extremely well in a government facility.
Dr.
So I
Patra,
believe
in a place like Noida.
Pratyaksham kim pramanam. So Noida is in UP, ma'am. Noida is in UP. Let me remind you, Noida is in UP. So don't worry.
I'm talking about the rural areas. Rahul Kanwal raised a question about rural areas.
So I have already answered about the rural areas also. In rural rural India is equally prepared. Don't worry, ma'am. The country is in strong hands. Have faith on Mr. Modi. Mr. Modi is doing the best. Will do the best. Thank you.
Okay, I'm out of time on this debate. We've spoken of the problems in what's being done.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.